Welcome to the podcast where we discuss health, health span, lifespan, and longevity. I'm Dr. Noor Gajraj. So, welcome to the podcast. My name is Dr. Noor Gajraj. We're going to talk about healthcare in the prison population. So, America has the largest incarcerated population, nearly 2 million people right now. Prisoners do have a constitutional right to care. There's a big need for medical care. Over 60% of people in US prisons have at least one chronic physical condition, including hypertension, diabetes, asthma, arthritis, various cancers. Infectious diseases are higher, increased incidence of hepatitis C, HIV, tuberculosis, very high incidence of mental health problems. Estimates suggest as high as 44% in jails and 37% in prisons. High rates of substance use disorders, and people recently released from prison experience a significantly increased mortality, 40 times higher for opioid overdose in the 2 weeks post-release. My interest is longevity and aging, and as you would expect, being incarcerated makes you age faster. So today we've got someone knowledgeable in this area, Kriya Patel. She is currently doing a fellowship, internal medicine fellowship in research, and she's also worked in the prison system for 2 years previously. So, Dr. Patel, thank you very much for being here. Perhaps you can just tell us a little bit about yourself, what you're currently doing, and tell us how you got started in working in the prison system.
Absolutely. Thanks for having me. We'll say it kind of all started in when I was an undergrad in Philadelphia. I had a class where we went once a week to the women's jail and you taught sort of these interactive health seminars. And it was a very eye-opening experience for me. It was truthfully heartbreaking. We did a week where we talked about intimate partner violence, and every woman shared a story of trauma that, an abuse that began quite young. After that class, I remember being like, this is just so wrong. Like, we are locking these women up instead of trying to help them. Like, they were abused very young, and that has directly led to some of these behaviors. And instead of trying to help, we just lock people up and
Right. Yeah.
and then are surprised when we release them and nothing changes. And so where I went to undergrad had a amazing opportunity where you could apply for grant funding for $150,000 if you had an idea of a program you wanted to do. And so I talked more with both the professor of that class, and she knew the medical director at the jail in Philly. And one of the problems back then, so we're talking like 2015, 2016, was when people were released from the jail, they were given 5 days worth of medication, maybe a prescription for 2 weeks or for, the next refill. And that was kind of it. It's crazy to think that anybody can get health insurance, get a doctor, make it to a doctor's appointment, get prescription and fill prescription
Mhm.
in 5 days. And so we were basically setting people up for failure. Like, whatever healthcare we managed to do while they were incarcerated, whether it was getting their chronic conditions under control or getting, mental health conditions also were very prevalent in the population. Like, anything that you did there was basically for nothing, because once you release someone, they didn't have any continuity of care. And so I really, I liked those 2 years. I think they were very educational for me. One of the biggest kind of realizations I had is, I grew up middle class. And so in my sort of sheltered privileged existence, I assumed everybody went to annual visits. Like, they saw the doctor once a year, they did preventative care. But when I was trying to enroll women in Medicaid, I would explain to them, what Medicaid is and what they can use it for. And they're like, if I'm sick, I go to the ER. And if I'm not, I don't need a doctor. And that was such a eye-opening moment for me where I was like, well, how do I justify this? How do I explain what preventative care is? And so that was a very interesting sort of challenge, but also eye-opening as to the kind of priorities and how to help people prioritize their health a little more. And so then eventually, that took me to medical school. And while in medical school, I continued to sort of do volunteering at the jails. I taught some health classes. And then I just finished up residency in internal medicine, and now I'm doing a research fellowship that focuses on health disparities research. So my hope is to kind of explore more about health outcomes for incarcerated populations, and especially that reentry period. Like, how do we improve people's access to healthcare and continue whatever healthcare gains they might have made?
Oh yeah, that's good. I'm always intrigued how patients continue with their medical care. So I presume that each prisoner is going to be interviewed by a healthcare provider to check their, medical history, what medications they're on. I would think there's going to be a lot of mental health issues. Depression and anxiety is going to be rampant, and that's going to be made worse by being in prison. So, they would need their antidepressants, and then, of course, hypertension, diabetes, heart disease. So, I mean, do they get assessed pretty quickly when they're, when they're in prison? Do you know?
I don't know for sure, but my guess would be that it probably varies based on where you are, because there's definitely a lot of variation too in like who's providing healthcare services.
Yeah,
When I was in Philly, it was a for-profit organization that went through different. I think they were called Horizon back then, and then they filed for bankruptcy in Texas, and now I think they're called Yes Care. But so, if they're providing care, they probably have their own protocols for how
yeah.
quickly they see people based on their staffing, versus here in the city of Chicago, it's provided through the city itself. So then they might have their own sort of policies.
It must be a lot of manpower and logistics just to give them their medication, right?
Yeah, I would definitely think so. And, I also wonder, does stuff get missed because of that, right? Like if
Yeah,
it's not the highest priority because the priority is placed on security and other things. So it is possible that that could get missed. Um, or like, what are you supposed to do if a patient doesn't know the name of the medication they're supposed to be taking, which I feel like happens all the time in the outpatient setting too, but we can kind of try to like look through, like in Epic, they sometimes have like the fill history or things like that, but like
yeah,
the jail medical system does not communicate with any of the outside systems. So,
yeah.
and I think the other piece too, that when I was working in the jails, I didn't have medical training at that time. So there's a lot of stuff that I just kind of wasn't aware of. But my understanding is also certain medicines will be on the jail's formulary.
Yeah.
And so it is also entirely possible that like just because our standard of care now is like an SGLT2 inhibitor, like I don't know if those have made it onto jail formularies.
Yeah, I would be particularly concerned about the mental health aspect because inmates, they have some mental health problem, and that kind of comes back to, whether they've got PTSD from a traumatic childhood. And you mentioned that for women, most of the women in prison have had a traumatic experiences, sexual abuse, all kinds of other things. So, and then being in jail, if you've got depression and anxiety, I mean, it must go through the roof. I mean, being locked up, must be a terrible feeling. I mean, some people just can't stand it. They go crazy just by the fact of being locked up. So what you were focusing on mostly is the care that they got afterwards. Would that be
Mhm.
right? Yeah.
Yeah, like how to coordinate if the services that they did get while they were in jail, like how do we make sure they can continue to access healthcare once they're released? But yeah, to your point about mental health as well, I think the other thing I will say is it was two different companies at the Philadelphia jail. So like one company provided physical healthcare services and another one provided mental healthcare services. So it is also entirely possible that someone might have a medical evaluation within whatever time frame, whether it's 24 hours, 48 hours, but then the backlog to see mental health is so long that you're not seeing someone quickly. I don't remember what the time turnaround is, but like you said, a lot of people have it. So I can imagine the like wait list for
Yeah.
getting into health services is a lot higher. And even when I toured the jail in Philly as well, it's like a window that's this big, right? So like the
Mm.
things that we say are good for our mental health, like sunlight, being able to go outside,
Mm.
outside area was very small too. And it was like just cement walls all around, like things that would definitely,
Yeah.
promote not having good mental health.
In fact, if you want to make health, if you want to make your mental health worse, prison would be ideal because it you just said it very well. It takes away everything or most of the things that improve mental health. So, for instance, exercise, a good diet. I'm sure they don't get good food. It's all processed, unhealthy, right? So that's gonna be bad. A good social, I mean, good social connections, right? They don't have any.
Mhm.
They're taken away from their family. So, I mean, I am concerned that, you're going to make mental health problems worse, and that's going to make them, more likely to commit crimes when they get out. I was just looking at dental care. Dental care is severely limited often, and it says that, some facilities have, in terms of dental care, an extraction only rule. So that's the only thing they're going to do. And I've
Yeah.
also heard that, a lot of prisoners don't even brush their teeth. They don't, that's not their priority. So, the things that you would normally think of people doing to try and keep themselves healthy are just not done. While they're in prison, we've got a big medical problem, a lot of needs, not enough resources. And then when they get out, that's going to be a problem, isn't it? So not just the medical part of it, but trying to get back into society, having a criminal record is going to give you difficulties getting a job. It's also going to cause difficulties getting accommodation. And then, as you said, I mean, 5 days of medication is not really going to do it. I think that needs to probably go up to a month. I mean, as long as they're not dangerous medications, which I don't think are prescribed anyway, any sort of controlled substance. If it's not a controlled substance, I don't know why they can't have a month. A month's worth of their blood pressure medication, a month's worth of their heart medication. Now, that would seem pretty basic to me. I think the fact that they're just given 5 days and, good luck doesn't really, we don't
Yeah.
treat
I mean,
prisoners.
I'm sure it all boils down to cost, unfortunately. But yeah, I
Yeah.
agree with you. I mean, even like I said, even if I was told today that I had 5 days to get insurance
Yeah.
and get a doctor, like I can do that knowing that I have stable housing and a job already. And I still probably could not do it in 5 days because it's just impossible the way our system works. So you're just almost setting people up for failure at that point.
I mean, the county hospitals, which are usually affiliated to teaching hospitals, I mean, that would be a good resource, but I don't think they're being connected with the county hospitals very much. I mean, I've worked in a county hospital. We saw a few prisoners here and there, but didn't really see any follow-up. I didn't see patients coming and said, well, they've got out of prison last week. I might be wrong. It's just maybe in my specialty. I treat addiction as well. And in fact, I would think there's a high percentage of patients with addiction that have ended up in jail, and it's been very counterproductive for them because, they have a medical disease. There's generally a lot of misunderstanding about addiction, but especially in prisons, it's like, well, you use drugs, you're a bad person, you've been stealing, you deserve it. But if you look at it, more logically, the reason why they've had these problems is because they've got a mental disease called addiction, right? So I wish that there was less punishment and more rehabilitation. Now, Portugal, for instance, they have a much more, I would say, enlightened approach that they will take people with addiction rather than sending them to jail. They'll um, they'll rehabilitate them. They'll set them up with a social worker, a psychologist. They'll do what they can to avoid putting them in prison, and then to help them, manage their mental health problems. So it is a bit of a trash can for people that haven't really been helped in the way that they should have been.
Yeah.
So anyway, now from your experience, let's say you got a huge grant, and they said, well, you've been in the prisons. You've got some idea of what goes on. I'm going to give you lots of money to make some improvements. What, maybe you could tell me some of the improvements you might make.
I mean, I think when it comes to the reentry part of it, right? If there was a way to make it a more warm handoff. And I know sometimes the challenge with a jail specifically instead of a prison where people in jail can be like either pre-sentencing, so waiting to see a judge and just haven't been able to afford bail. But so like not having a set release date does make it hard, right? Like someone might finally get before a judge and the judge says, you've already served enough time for this crime that the charge you have against them. So like they get released that day.
Yeah.
So
Oh, yeah. Yeah.
that does definitely make it a bit of a challenge, but I think as much as you're able to coordinate like a first appointment for them or like it's tough because I think the other problem was like by the time someone got back from court, then the jail would go through whatever paperwork processing it needs to do and then release someone. Someone could be being released at like 10 p.m. at night. So obviously at that point you can't, have them go directly to a clinic. Clinics aren't open or have like some kind of like I've been hearing about here there's like a trailer that people can actually go to if they're leaving jail just to like get some resources.
Mm.
But at 10 p.m. at night, I don't know if that would be
Yeah.
very realistic, but something like that where I think hope like if the medical records could coordinate better so that providers on the outside could read about providers' notes inside and see exactly kind of what treatment they were started on. And then, if they were insured to have insurance from day one so that they could be covered for whatever prescriptions they need to fill. And ideally like establishing with a primary care doctor within like that first week.
I'm seeing here that one problem with facilities is lack of uniform standards. So, although they have a constitutional right to medical care, there aren't mandatory standards for healthcare across correctional facilities, and that can contribute to a uneven system. But anyway, coming back to what you were saying, it sounds like there needs to be some kind of it's almost like in a hospital, a discharge coordinator, right? Somebody that
Yeah,
would, I mean, really set them up with all these things, before they're released. You know,
right.
you're, you've mentioned the lack of notice sometimes, there can be a knock on the door by the officer, all right, you're out.
Yeah.
And they don't really have time for that. But it occurs to me that there should be a discharge team. So anyway, that was the reason I wanted to get you on here is to kind of bring attention to a subject that people don't pay any attention to, really. I hope people listening to this realize that there are sick people incarcerated. They're sick mentally and physically. And, it's only humane to try and help them. We're healthcare providers. At the core of it, we want to make people better medically. And I think there's room for improvement. But the first step is awareness. We have this problem, it needs to be improved. And I think this is a good step. So I want to thank you. Is there anything else that comes to mind that you would like any listeners to know about? I think we've covered the quite a bit of ground and giving people some food for thought.
Yeah, no, I think you summarized it really well that, it's really easy to overlook, but it is a substantial amount of our population who is impacted by, the criminal justice system and specifically when I worked with women a little bit more, right? Like they're also often primary caregivers, right? So think about the impact you're having on their children. And so I just think it affects a lot of people and it's good to bring some light to the issue.
Thank you very much. Hopefully, we'll talk again about another topic. So enjoy the rest of your day. Please consider buying my book, 100 Pathways to Longevity, and subscribing to the channel. Thank you again.